You mentioned nutrition. Knowing what you know, I'm just curious, what kind of diet do you eat?
I try to, everybody's different, of course. I found out that, well, first of all, high blood sugar is not good for anybody. Blood sugar spikes is not good for anybody. But me in particular, as I found out later on from the CGM, right, continuous glucose monitor, is that my blood sugar responds to something like rice or any carbohydrates very drastically and not very good because it spikes my blood sugar.
Carbohydrates.
Yeah.
Okay.
So I try to eat a low carbohydrate diet. And if I do eat carbohydrates, then it's going to be more complex carbohydrates. Yeah. In whole grain.
Yeah.
Carbs.
And are there certain things like certain superfoods or supplements that you think are really good when it comes to, especially the longevity or the anti-aging component?
Yeah, there's so many. It's so crazy these days. And it's, there's some that I think are great, like AFA, you know, the blue-green algae I do take, and resveratrol. Sometimes I take. I'm not very good. I've been super consistent, but mushrooms, I'm a big fan of different types of mushrooms. Very powerful.
Have you heard of Dr. Sandra Kaufman before? She has this whole book called The Kaufman Protocol, and she prioritizes all these different supplements and nutrients specifically for longevity effects. And she has a whole like a table that shows their ranking. And I recently interviewed her. I think she said that the top one, I think it might have been astaxanthin was like at the top of the totem pole. Curcumin was way up there. Okay. There's one other I hadn't heard of before.
Are you taking
go back and check her book? Not regularly. No, I mean, like I'll take certain cocktails of stuff. Like you talked about that stem regen, for example. Yeah. I think that's just a cocktail of a bunch of those type of things, right?
Yeah. I think about 5 different herbs.
Yeah. And you use that with your patients to help prepare their body for stem cell infusions?
Again, if I can give them a little edge with the treatment, because I don't really care that I don't know what's doing what. I just want people to do better. And because I know how these things can enhance the body, I just want people to get everything so they can get a lot of, you know, the maximum benefits.
And there's so many exercise modalities associated with longevity too. You know, grip strength or VO2 max or lactate tolerance or any of these things. Do you prescribe certain exercise protocols or do you favor a certain approach to exercise?
You know, I think that you need a balance between strength training and cardiovascular training. So it would be good if a person can do something that incorporates both. You know, at one point I was only doing Zumba dance, so that's more cardiovascular. So another point I was only doing Pilates, you know, which is more resistance and the strength training.
Zumba is very cardiovascular for me, by the way. I'm not very graceful on the dance floor. I'm not very inefficient at Zumba.
What's interesting, I think people are of better shape in my Pilates class than people in the Zumba class. So you see all these women, we were all dancing together, but I see so many, most of them are overweight and they're all dancing like crazy. They were all, you know, really sweating and doing the best they can. And they may do it a few times a week. So it's curious, why are they still so overweight? I think one is poor nutrition. They're putting things in their body that's preventing them from actually having an efficient metabolism. The other one, not enough weight training and strength training. Yeah. So
probably a little bit of self-selection there as well. I think probably the demographic that would frequent Pilates might just be generally more aware of fitness, nutrition, etc. than the person who signs up for the dance class. Yeah. Maybe I might be stereotyping.
And it's even better in hot yoga. So now I've incorporated hot yoga, which is a little bit more cardiovascular, more stretching. And so that's, I think, you know, I found a nice balance.